Well, isn't that funny, right? Here we have it's week 4, and we're talking about the immune system right here and the heart. So, oddly enough, you probably got the message that I did have a heart attack on Friday last week. As you can see, I don't know, maybe you can see there's some bruising here because I had a catheter, which is a tube that was put in my radial artery, sent all the way up through the subclavian artery, right into the heart, and went to what's called the anterior longitudinal uh, artery and found 2 plugs. And so I had 2 stents, which are little tiny cages that open up that area. I did have, and if you read the assignment in there, kind of the same thing. I had arm pain, not neck pain, not shoulder pain, not jaw pain, anything like that. I didn't have any of the hallmarks of a real heart attack, as you would say, which would be like sweating or diaphoresis. That's what that means. Nausea, any kind of woozy feel or anything like that. I wasn't like turning peaked or anything. It was just arm pain, like really severe arm pain, like 9 out of 10. And it lasted about 2 in the morning. When I got there, they gave me 3 actually nitroglycerin tablets. And nitroglycerin tablets, which I have right here, I'll show you. These kind of cool. They're like little tiny old things, man. There's like little bitty old things. They don't explode when you drop them. At least I hope. But they're like this big. They're little. Look at how tiny that is. And you stick them right underneath your tongue. And you wait for 5 minutes. And if after 5 minutes the pain doesn't subside, then you take another one. And then you do that a third time. If you do that a third time, you got to call 911. So what they did with me is they did an ultrasound of my heart, or a like a Doppler ultrasound. And that's where they found some movement problems and things. And I also have what's called a murmur, which is a mitral valve prolapse, which is one of the valves. We have 4 valves in the heart, and that's one of them. Mitral means it has 2 parts. It looks kind of like the Pope's hat, is why it's called that way. And I did have that catheterization, and I have an EKG. I had many EKGs, a lot of them, and they were measuring troponin. And if you remember troponin from the first discussion, they talked about how they measure that. Now, that's an enzyme, a protein that your heart muscle releases when it's damaged, and it'll start to go up over a couple hours, and after about 4 hours it hits its peak, and then depending on what else happens, if there's more damage, it keeps going up. Now it can go up to like 300,000, and like usually most people it's around zero 0.2 or 0.02, something like that. It's very, very small. Not even one. Not even one, maybe 2 total. Mine got to 30,000, which is incredible. But when you think of like a big heart attack, usually around 300,000, it was considered kind of like a mild, almost moderate kind of heart attack. But it spiked up. So it started at about 277 after about when I first got there. And then after a couple hours, it went to about 400. And then it went to 1,700. And then it went to 12,000. And then it went to 30,000. And then it went down to 20,000, then 16,000, then like 12 again. So like once it hits the peak, they stop checking into it. So anyway, just wanted to give you guys a heads up. Things are doing good here. I'm doing much better. Thank you very much for... nobody really cares. I mean, but I'm doing good. I'm awake and doing my thing. I was really tired. My arm is killing me. It really hurts because that's where that's from. This is the right arm, and they did that catheter. You can see you see a little hole right there. And this is about 3 minutes and a half or something. And I wanted to end that there and just give you guys keep going. The discussions look so much better. Thank you. Good job. Very good job. More 100% than I've ever seen, which is really damn good. And I'm proud of you. Thank you. We'll see you soon. I'm going to do another one later on today.